So here you can see, so here, and this will lead what is happening inside their head, thing like this. It will bend this shoulder and this shoulder. This is Hello, I'm Dr. Aizaz from MedicoVisual.com, and in today's visual lecture we will talk about the histogenesis of semicircular canals. Now, we have already discussed the gross development of semicircular canals, and you can see the link in the description as well as in the pinned comment to understand that how grossly the semicircular canals develop. Now, we have three semicircular canals: the anterior one, the posterior one, and the transverse or lateral or horizontal semicircular canal. All these three semicircular canals, they are connected to this common cavity which is called utricle. Now this is the membranous labyrinth, and outside the membranous labyrinth is the bony labyrinth. So here I have made the bony labyrinth actually otic capsule slightly translucent, so here you can see the orientations of the things that are inside. Now, to understand the semicircular canals, imagine the room, and here you can see, here we have a floor of the room, and then there is that interior or front wall, and we have posterior wall. Now this floor is basically representing horizontal or the lateral semicircular canal. Then along this interior wall we have this interior semicircular canal, which is also, by the way, called superior semicircular canal. And then along the posterior wall we have the posterior semicircular canal. Of course, in this room, in this fictitious room, we do not have a roof, so we do not have the fourth semicircular canal. We have only three semicircular canals. Now in this lecture we want to look inside that what is the sensory organ of the semicircular canal and how it develops. Basically here we have these dilated ends. So here you can see we have these dilated ends of the semicircular canals. Now within the dilated ends of the semicircular canal, for example, here is one, here is the other one, and here is the third one. These are basically called ampulla of semicircular canals. So within the ampulla of semicircular canals, the sensory organs develop, the sensory receptors develop, and these sensory receptors are involved in sensing the angular acceleration. So they are involved in sensing the angular acceleration, and today we will discuss that how these organs develop, how these sensory organs develop, and then briefly we will talk about that how do they work. So what I will do is that we will remove a part of it. For example, here you can see we will just remove this part. Let's suppose we are taking a section here. I hope you can understand it clearly how I'm gonna show you the section. So here you can see that here we will take a section like this, and we will just see this part. We will focus only on this part. We will enlarge this part, and we will see that what is going on inside and how the sensory organ develop at the histological level. So we are going to see the histogenesis of semicircular canal. Particularly we are focusing on histogenesis of ampulla of semicircular canals, and the reason why we are so concerned about the ampulla of semicircular canal is that the sensory organ of the semicircular canal, it develops within the ampulla. So let's see how it develops and how it works. So here is that cut section, and let me make it more clear for you that let's suppose here is the, it was like this. This is the semicircular canal, and it was like this. This is the membranous labyrinth part. So it is continuous like this, and here it will be continuous with the, what is here? Here is the utricle. So let me make it very clear for you, and of course it is continuing as the semicircular canal, and of course this is that dilated part, ampulla, and here outside it is that otic capsule. So I hope you can understand, this is the otic capsule. Here it is continuing with the vestibule, and here again it is forming the the outer covering, the aortic capsular covering of the semicircular canal. And please don't forget that inside this, what is this? Inside this membranous labyrinth, whole this membranous labyrinth is filled with high potassium fluid, which is called endolymph. It is filled with endolymph, and outside it is the bony labyrinth, which is filled with another fluid called perilymph. So please understand that outside it, there will be the other fluid, which is the perilymph. Perilymph provide the support to this, and it decreases the friction, and it sorts of act as a cushion around the structures of inner ear, around the structure of membranous labyrinth. So this is the perilymph. Perilymph is surrounding the membranous labyrinth. So please understand these basic concepts very carefully, and now let's move forward. Now I hope you understood that we have removed just a part of it to focus on the histogenesis of ampulla of semicircular canals. Now what will happen that from here, the aortic capsule, this is the bony part, this bony aortic capsule, some part of this bony aortic capsule, what it will do is that it will grow and it will invaginate, and it will sort of lift this part of membranous labyrinth upward, and here a crest will be formed. Let me show you exactly with the animation, it will be very clear. So here you can see it has lifted it upward like this. Isn't it beautiful phenomena? So it has lifted this part of membranous labyrinth, and here of course this membranous labyrinth is made up of some cells, and these cells, they will differentiate to form the supporting cells. These epithelial cells, they will form the supporting cells, right? They will form the supporting cells. And by the way, now this structure, this crest that has been formed, it is called crista ampullaris. Let me write it for you. Cristae ampullaris, crest of the ampulla of ampullaris, crest of ampulla of semicircular canal. So this crest like structure is formed here, which is crista ampullaris. So this is the crista ampullaris. Then what will happen that, well, this epithelium, it will not just differentiate into supporting cells, but at the top of the crest, some of these cells will actually be differentiated into specialized hair cells that are actual sensory organs. So these are the hair cells. So you see, hair cells are interspersed at the top of the crest. Please understand that at the top of this crest, at the top of crista ampullaris, the hair cells of semicircular canals, they are interspersed in between, the bed of supporting cells. So I hope you are very clear about this. And of course, these hair cells, they are connected with the dendritic process of a branch of vestibulocochlear nerve. So here a branch of vestibulocochlear nerve will also be connected to it, and we have discussed the formation of vestibulocochlear nerve previously. You can watch that lecture to understand it. Now what will happen that these epithelial cells, and perhaps the hair cells as well, well, to be honest, the exact origin of copula is not known. So what they will do is that they will secrete gelatinous material on top of it, and this gelatinous material is actually called copula. So I hope you can understand. Here the copula is formed. So that is all about this sensory organ of the semicircular canal called ampulla cristae ampullaris. Now briefly we will talk about that how it works. Now one thing you understand that, as I have told you previously, that here we have the other part of semicircular canal. Again, let me draw it for you. So here is the other part of semicircular canal like this, and here it is connected with the utricle, and of course other semicircular canals, they are also opening into it. Let's just not draw that again. Here is the aortic capsule, So now what will happen that, as I have told you, it is involved in sensing the angular acceleration. So for example, if a person rotates, I will give you example later. So as the person rotates, what will happen again due to inertia? For example, the person's head is rotating like this, in this direction, like this. What will happen that the fluid from the semicircular canal, it will try to sort of, due to inertia, it will try to rush into the utricle like this due to inertia, and it will be sort of rotated like this. The copula will be rotated. The capula or copula, it is actually touching, almost touching the roof here. So as the fluid rushes here, it will sort of tilt here like this. Let me show you the animation, and then you can easily understand that how it is working. So let's watch the animation. So here you can see what will happen, that it will rotate. So here you can see it is rotated like this, and as it rotates, the hair cells also rotated. Not hair cells, I mean the cilia of these hair cells, they also bends. So here you can see the hair cells, cilia of hair cells, they bend. And as I have told you previously, the bending of cilia of hair cells, it triggers the opening of potassium channel. This is similar to what happens in macula, and on the top of that there are these potassium channels. And by the way, I have described it in details that how it open. So these potassium channels, they open, and as they open up, potassium will rush into these cells. And as the potassium will rush, these cells are unusual that they are depolarized with the help of potassium. Most of the cells, they are depolarized with sodium. Some cells, they are depolarized with calcium. But these cells are unusual. All the hair cells in the inner ear, whether it is the macula of the utricle or the saccule, or whether it is the semicircular canal, or even if it is the organ of corti of the hearing part of the cochlea, all these hair cells, they are unusual in a sense that they are depolarized due to influx of potassium. So due to influx of potassium, these cells are depolarized, and then I will not go into details, but they will release certain neurotransmitters on the other end here, and this will lead to depolarization of this nerve as well. So this message is then conveyed to your brain that angular acceleration has been started. So in this way, your brain will know that okay, the head is rotating, the person is rotating. So that is how the semicircular canal, they help in detecting the angular rotation. So that is how semicircular canal, they help in detecting the angular acceleration. Please watch this Sufi dance and focus on this. So you see they are rotating, these dancers, they are rotating. So what is happening inside their head? Let's briefly talk about that, how this angular acceleration, how this is sensed inside their head. There is the role of semicircular canals that we will just talk about. Let's suppose here is the head of a Sufi dancer who is about to start this whirling dervish dance. And what will happen inside the head? Let's just focus on the copula of transverse semicircular canal or horizontal semicircular canal, because these are the type of semicircular canal that are mainly involved in detecting the angular acceleration in this particular case. We will talk about the other ones in a moment, but let's just focus on these. So what will happen that as their head rotates, the rotation of head, it will cause tilting of these copula of horizontal semicircular canal like this, that it will rotate like this here. And on the other end, on the other side, the rotation will be exact opposite. Actually, it depends upon whether there is clockwise rotation or anti-clockwise rotation. Obviously the result will be different, so let's not go into that, and let's see that they are now rotating like this. They are rotating like this. And to understand what is going on inside their head, we will take a close-up look. We will zoom into his head and we will see what happens. So as this angular acceleration started, the copula tilted, but as he achieved the uniform velocity of rotation, the copula returned back to their normal position. So that's how the angular acceleration, not uniform velocity, but angular acceleration is sensed by the presence of these horizontal semicircular canals. To understand the physiology of semicircular canal, let me tell you an analogy from the real life. For example, this is a pipe, and let's suppose here this pipe is actually like a semicircular canal. Semicircular canal. And here, as the pipe opens, it is opening into, for example, the utricle. The environment is, for example, the utricle, and here is the copula. Actually, capula or copula is somewhat here, but for the sake of understanding, so you can see it what is going on with the copula, let's suppose we have taken the copula out into the utricle. Of course it is not true, it is just for the sake of understanding. Now what happens that as the head rotates, the fluid from the semicircular canal, it rushes into the utricle, or other way around may also be there, that fluid from the utricle, it may rush back into the semicircular canal. Let's assume that fluid is rushing from the semicircular canal into the utricle. So what will happen, that as it happens naturally, the copula will be tilted like this, and as it is tilted, what will happen, that the cilia will bend, and this will be sensed by our brain. From this water pipe, the water will come out, and as the fluid rushes out, it will tilt this, it will bend this copula. Well, it is not actually a copula, it is the piece of plastic that I have used here. So let's watch this video. This is not animation, this is actual video. So water will rush out and it will bend this. So you see it has bent it like this. Let's watch it again. So here is what exactly happens, that it will bend this plastic piece or copula. So that's how the semicircular canal works. Now let's briefly understand the significance of other semicircular canals. Now here this person, now let's suppose what happens, that he moves his head like this as if he is saying, yes, I am willing to do this task. Now in this moment, you tell me that which semicircular canal is involved in sensing the angular acceleration in this case. Let's watch the animation again. So he is rolling his head in order to say yes. So I hope your answer was this interior or superior semicircular canal. So as you can see, that head is rotating like this, forward and backward, and in this kind of motion, the interior or superior semicircular canal is main canal that is involved. Of course, these are not in the perfect orientation, so some role of other semicircular canal is also there, but mainly it is the interior or superior semicircular canal which is involved in sensing this type of rotation of the head. Now let's suppose this person does another type of movement and he is saying, no, I am not gonna do this task. So he says no. That's a big no from my side. Let's watch the animation again, and I hope you can tell me which semicircular canal would be involved in sensing this type of rotation. I hope you will say it is transverse semicircular canal or horizontal semicircular canal. This one here is this transverse or horizontal semicircular canal, and as the head rotates along its z-axis, Z-axis, by the way, this one, this is the Z-axis. As the head rotates along this axis, it is the which canal? It is the horizontal canal. And of course, as the head rotates along this axis, it is the anterior or superior semicircular canal. It is horizontal. And final one, what is the other one? This is this one. So that is the posterior one, and posterior semicircular canal is involved in sensing what type of rotation. Let me make you watch another animation. This is called head roll. That head first touches one shoulder and then touches the other. So here of course there will be right shoulder, and here there will be left shoulder. And in this type of movement, in this type of rotation, the head touches this shoulder and this shoulder. This is called neck roll or head roll. And in this type of movement, in this type of rotation, this type of rotation is actually sensed by which semicircular canal? It is sensed by the posterior semicircular canal. So these basic movements that you must understand, that they are sensed by which semicircular canal. Of course, the rotation of head along almost any axis can be sensed by these semicircular canals. And these semicircular canals, if there is some odd axis, rotation along some odd axis, all these semicircular canals, they are working in coordination, so they can easily tell the brain that what type of rotation is going on. But what these semicircular canals, what they cannot do is that they cannot tell the static position of the head, and they cannot tell the effect of gravity. They cannot sense the effect of gravity because they lack the otoconia. So here there is an important difference between the macula and the crista ampullaris. So here you can see this is the crista ampullaris and these are the macula. These are basically not the complete macula, they are the part of macula. So here you can see that macula, they have these otoconia or otoliths. These stones are there on the top of this otolithic membrane. These stones are somewhat heavy and denser, and because of their heaviness, because of their weight and density, what they do is that they can sense the presence of the gravity. So due to the presence of gravity, this is for example macula of utricle. This macula of utricle, within this macula of utricle, due to presence of the gravity, there is some particular tonic effect is there. So it is tonically, these you can see these hair cells, they are slightly bent even at rest due to that tonic effect, tonic pressure of these otoconia, their tonic weight. There is that weight, inherent weight, and they are tonically slightly bent due to presence of these stones. And there are many different mechanisms. Let's not go into detail. There is another concept called striola. Let's not go into striola. Due to this orientation of hair cells along that striola, it can also sense the exact position of the head. So that is due to the presence of otoconia, the effect of gravity and the effect of and the static position that can be sensed by macula. For example, if you focus here on the saccule, if the head is in upright position, the saccule, their otolithic membrane, it will be tilted downward again due to the effect of gravity. So this is due to presence of otolith, and that is the reason why the sensory organ of macula, the sensory organ of utricle and saccule, they contain the otolith, but the sensory organ of semicircular canal, they do not contain any kind of stone, any kind of otoconia, because inherently their functions are different. If we briefly talk about that, the semicircular canals, they are involved in what? And utricle and saccule, they are involved in what? These are involved in sensing what? The one thing is common, they sense the acceleration. This also sense acceleration. These also sense the acceleration. Here they are sensing the linear acceleration. Utricle along the horizontal axis and saccule along the vertical axis. Both are sensing linear acceleration. But semicircular canal, they are sensing the angular acceleration, the rotational acceleration. That is very important. So this is the only thing, mainly this is the only thing that can be sensed by semicircular canal. But here the utricle and saccule, along with the linear acceleration, they can also sense the static position of head in 3D space. Static position of head in the 3D environment, that where the head is located. Along with that, of course, they can also sense the effect of gravity. So if you are, for example, standing on moon, you are standing on moon in the upright position, your head is in upright position, there won't be significant tonic effect of these stones because gravity is low on moon, so there won't be significant tonic effect of these otoliths, otoconia, and these hair cells at the static position, at the resting position. They won't be bent slightly, so you will know that gravity is low here. So you will know when you are on moon and when you are on earth, so you can sense where you are. This is the beauty of sensory system of our body. Our nervous system is so brilliantly designed. I am so amazed to look at it, and I love teaching about our body, the anatomy, physiology, embryology, even biochemistry. Our body is so beautifully designed. I am so fascinated about the design of our body. So that was about today's lecture. Thank you so much for watching this video.